Couple of big holidays we've had, we have seen the number of infections spike after the holiday, this time with more than half of Massachusetts fully vaccinated. Are you confident we will not see an increase this time around?
Confident may be putting it too strongly, but I would say cautiously optimistic. Yeah, I'm hopeful.
All right, the state's COVID restrictions, as you know, ended Saturday, but our reporter who was on this story today, Sharman Sacchetti, spoke with a lot of people who say they're just frankly not yet ready to remove their masks. Is there any medical reason why people who are fully vaccinated should leave one on?
Yeah, so there are non-medical reasons. There are reasons of comfort and anxiety, but there are medical reasons. I think probably the most important medical reasons is not everybody responds to the vaccine. A significant number of people who are immunocompromised or have other problems may not respond to the vaccine. So even a fully vaccinated person might want to wear a mask in that setting. For example, people who've had an organ transplant or people who want cancer chemotherapy, and that's not a small number of people. Also, we're still wearing masks in medical settings in the hospitals, and people should still go if they have to visit someone in the hospital, if they be in the hospital, have the expectation that still masks are useful there. I guess I would also say if you were going into a very high-risk situation with all sorts of people packed together in an inside venue, I don't know, a concert at in an arena, you might put a mask on there. But the main one is that people, just because they've been vaccinated, there are a small but not insignificant number of people who are still not protected.
Well, and one group of people that will still be wearing masks, at least for the time being, children under 12 and their families. What's your advice to adults who may find themselves near those young kids? Of course, there's no vaccine available for them yet, maybe at a store or an event. Should they keep their distance? Should they put a mask on, even if they are fully vaccinated, the adults?
Yeah, so leaving aside the people who have reason to think that their immune system may not be fully functional. So that's an important group of people. If that group of people, I would put on a mask. But for the person who with a normal immune system, who has been fully vaccinated, children have been not immune to this virus, but have been at smaller risk than adults. So I don't think that for the ordinary person in the ordinary circumstance, people should worry, and they should just go about their business as usual.
All right, we now know nearly 2/3 of the state has received at least one dose of a vaccine. That means the other third may still be on the fence about getting a shot. So what do you want those people to know?
Yeah, I would say two things. I would say first, look at what the people who know most about the vaccine are doing. And the people, so I'm a virologist who's done vaccine research, look at the public health people and the people who are working on vaccines. All of us rush to get the vaccine, or nearly all of us. So there are very, very high rates of vaccine use among the people who know most about the safety and the efficacy of the vaccine. So I think that should be very telling for people who might be on the fence. But the second thing is also important, that vaccines are something we do not only for ourselves, but we do for one another. So vaccines are very much a collective community thing that we help protect the most vulnerable members of our population. So a good reason to get vaccinated is to protect yourself, to be sure, but also to protect other vulnerable people in the community. And it's something we can do for one another.
All right, Dr. Robin Colgrove, infectious disease specialist at Mount Auburn Hospital. Dr. Colgrove, thanks for your time on this holiday.
My pleasure.